Hello everyone. Today on International Women's Day, we celebrate women's strength. But on this auspicious day, I want to talk about something that is silently weakening the health of our girls. PCOS, Polycystic Ovary Syndrome. PCOS begins early. It is one of the most common hormonal disorders affecting adolescent girls and young women in modern life. That is why talking about PCOS on International Women's Day is very important, because women empowerment doesn't begin with success alone, it begins with health. PCOS affects fertility, it affects menstrual cycles, it affects metabolism. Women with PCOS are more likely to develop certain serious health complications such as type 2 diabetes mellitus, cardiovascular diseases, and even uterine cancer. One of the most common symptoms of PCOS is irregular menstrual cycles like oligomenorrhea, cycles lasting longer than 35 days or fewer than 9 periods per year, and amenorrhea, complete absence of menstruation. Another important symptom is excess androgen hormones. Gynecological ultrasound is a powerful imaging technique to identify multiple tiny cysts in the ovaries. PCOS presents in 4 main phenotypes: A, B, C, and D, depending on a combination of presence of any 2 out of the following 3 criteria: hyperandrogenism, ovulatory dysfunction or irregular periods, and polycystic ovary morphology. One of the clinical manifestations of hyperandrogenism in PCOS is the cutaneous symptoms, and it can vary widely, but some of the most common include hirsutism, excessive terminal hair growth on the face and chest, acne, often treatment resistant acne, typically along the jawline, acanthosis nigricans, velvety dark thick skin patches in folds in neck, armpits, indicating severe insulin resistance, and another one is alopecia, female pattern hair loss, usually top of scalp thinning while the hairline is preserved. These symptoms arise due to hormonal imbalances, especially elevated levels of male hormones. This condition can lead to significant emotional distress and impact self-esteem. PCOS begins with a disturbance in the hypothalamic pituitary ovarian axis, where increased gonadotropin releasing hormone pulse frequency from hypothalamus, which sits deep within the forebrain, leads to excess luteinizing hormone secretion from pituitary glands located just bottom of the hypothalamus. This LH stimulates the ovarian theca cells to produce excess androgens. So, PCOS starts from the brain. There was a time when PCOS had a very clear face. It was mostly seen in obese girls with excess body weight, with excess fat, with sedentary lifestyle, used to excess calorie intake, and all these lead to insulin resistance. In obesity, especially visceral fat, inflammatory cytokines, and free fatty acids interfere with insulin signaling pathways, making the body less responsive to insulin. This excess non-responsive insulin directly increases ovarian androgen production and prevents normal follicular maturation, leading to anovulation and development of cysts in the ovary. It was visible, it was expected. But today, PCOS has changed. Today, even lean girls are developing PCOS. Girls with normal body weight, girls who look completely healthy, yet inside their hormones are disturbed. This is called lean PCOS, and this is more dangerous because it remains unnoticed. In lean PCOS, the problem is often the hidden insulin resistance, mitochondrial dysfunction, and increased sensitivity of ovarian cells to insulin, even without visible obesity. But the question is, why this is happening? The answer is, PCOS is largely lifestyle driven. Long hours of sitting, excess screen time, late night mobile use, lack of physical activity, disturbed sleep, high calorie, low nutrition food intake. The result, from the outside, the body looks normal, but inside, insulin becomes resistant, hormones are losing their balances. This hormonal imbalance leads to follicular arrest, where immature follicles accumulate in the ovary, giving the classical polycystic appearance and disrupting ovulation. And this PCOS begins silently. Another important issue called the epigenetic factor is vitamin D deficiency, which is prevalently observed among patients with PCOS irrespective of obese and lean. And recent research found that vitamin D deficiency or vitamin D insufficiency serves as a significant contributor to the exacerbation of insulin resistance, hyperandrogenism, and irregular ovulation. Why and how? Vitamin D is essential for proper functioning of insulin receptor expression and function, which are again essential to maintain normal glucose level. Vitamin D can modulate lipid profile. Vitamin D promotes anti-inflammatory activities and suppress pro-inflammatory substances. Vitamin D maintains balance of different reproductive steroid hormones like androgens and peptide hormone like anti-Mullerian hormone. And a long-lasting, even minute deviation of all these profiles can lead to disorders in follicular development. Another important area of concern is psychological and physiological stress. They contribute to the development of PCOS by increasing the levels of cortisol, the stress hormone, and androgens, thereby establishing a vicious cycle of insulin resistance, inflammation, and oxidative stress. These kinds of persistent stressors activate the hypothalamo-pituitary axis, leading to the elevated androgen from adrenal glands like dihydroepiandrosterone sulfate and cortisol levels, which interfere with ovulation and worsen metabolic dysfunction. Yes, there are rays of hope. PCOS can be controlled can be managed, and not by medicine alone, but by the lifestyle correction. Number 1, just 30 to 45 minutes daily physical activity can improve your insulin status, because muscle contraction increases glucose uptake independent of insulin and restores metabolic and hormonal balance. The cumulative effects of all these can normalize the menstrual cycle. Number 2, reduce your screen time, specifically at the night time. Hormones will get time to recover. Number 3, sleep properly, minimum 6 hours within 10 p.m. to 7 a.m. Your own circadian rhythm, normalize control cortisol, insulin, and other reproductive hormone levels. Your endocrine system heals and say goodbye to PCOS. So, on this International Women's Day, this is our message to every adolescent girl. Yes, PCOS is one of the biggest health challenges of modern young women. It may affect the obese, it may affect the lean, it may affect anyone living an unhealthy lifestyle and any time in reproductive life. But you have the power to prevent it. Move more, sit less, sleep better, respect your body, protect your hormones. Women empowerment is not only about voice, it is also about your biology. When a woman understands her hormones, protects her health, and takes change of a lifestyle, that is real empowerment. So spread awareness, protect our daughters, protect our future, because PCOS awareness is women empowerment. Happy International Women's Day.